Hi, I'm Dr. Leslie Pasco, and I'm here at the Owners Conference at MGE. And we just finished up a super exciting session on HIPAA compliance, the 5 common mistakes with HIPAA compliance. And I have with me here Dr. Danika Brinda, and I'd like to ask her a few questions about HIPAA and share that with you.
Great.
Yeah, so Danika, welcome.
Thank you.
It was a great presentation, by the way.
It was fun, a great audience. It was super fun and exciting.
I know, like who knew HIPAA could be fun?
I did. I like to push that on other people too.
Yeah, well, you did a great job.
Thank
It
you.
really was really good. So everything that you talked about today, there was a lot of information. What would be the one thing that you want the attendees in your presentation to take away with them?
Right. We did go through a lot of stuff. The biggest thing I want people to know is HIPAA compliance is attainable, and it doesn't have to be this huge white elephant in the room that you never want to touch. That there's simple solutions out there that can help you. There's websites that you can go and read, and it doesn't have to be something that you fear or that you don't want to do anything with. And also, it's not something you can ignore anymore. It's something that you have to put practices and policies in place in your organization to make sure you want to safeguard your patient information.
Sure. Yeah, absolutely. Yeah, so it sounds like, and what I was getting from what you were talking about today, it's more comfortable.
Yes.
Yeah, it's like a comfortable approach to it and being more comfortable knowing about it and getting those things in place.
Right.
Yeah, because when HIPAA first came out, it was uncomfortable.
It was uncomfortable, and in some cases it still is. But I think the biggest thing for organizations too is to know that you don't have to do it overnight. It's something that sometimes takes 6 to 9 months to build a true compliance program and feel good about what you're doing. So it's okay to take that time if you're starting from scratch too.
Yeah, and that's something that you do. So you're a HIPAA consultant. So tell me what a HIPAA consultant is, or what you do.
For sure. Yeah. I do a lot of things. For HIPAA consultants, specifically in the dental world, what I'll do is I'll go in, I'll help them look at areas that they have risk in, whether it's adding new technology, whether it's putting a privacy screen over a monitor so it can't be easily seen, moving around paper if we need to. We do policy and procedure development, so putting practices in place on how they comply with the regulation. Unfortunately, that is a part of what you have to do, so I'll actually build those for them. HIPAA training is a big thing with the workforce, not only regular HIPAA training, but new workforce training, and anytime annually that you want to be able to do that or throughout the year is an important thing too. So I do all aspects of that. Planet HIPAA actually has a product that's fully online that we're able to do those with simple solutions, filling out forms, and it actually produces everything that the clients need. It's stored in a secure environment, so they don't have to print anything out and don't have to have paper sitting somewhere. It's always accessible electronically, which is kind of a nice solution versus having it sit on your cupboard and collect some dust. So it is a product that is out there that's a simple solution, as simple as you can make HIPAA, and we're really proud of it, and it has helped a lot of organizations feel better. And as some of my providers tell me, it helps me sleep better at night too, which is important.
That is so worth it.
That is important,
so
yes.
worth it. So you're suggesting that it's done annually or how often?
So I always say that HIPAA compliance should be looked, from a training perspective annually. Look at your policies annually too, just to make sure nothing has changed. You always want to make sure you're following what's in your policies, just because if you're not, you can sometimes be found out of compliance with that. But making sure everything's tuned up, just like we tune up a car, we just want to tune up our HIPAA compliance on a regular basis. So
wow, it sounds like you've made it very easy.
I've made it as easy as you can make HIPAA. Asking questions and prompting and being able to put the policies and create customized policies is my biggest thing. I'm not a boilerplate language person. I want to make sure it's for each dental organization and it's what their practices follow. So it really takes what an organization is doing and ask the simple questions to be able to create their manual for them.
Wow, that's really fantastic. I mean, where were you when I
I
started my practices, right? That's fantastic.
Yep.
Yeah, well, I'm good. I'm glad you're here now.
Yeah,
so,
thank you.
Yeah, so this kind of makes me think a little bit, like, what attracts you to this HIPAA concept? I mean, most people tend to shy away from it, and you just love it, obviously.
I do.
So what got you started in all this in the first place?
So I was involved in a grant project years ago where there was an incentive to implement electronic health records from the federal government. They were actually helping organizations fund electronic health record development, ultimately to fund interoperability. Big fancy word, right?
Yeah.
Everybody being able to communicate with each other. So there was incentive, and I was part of a grant project in Minnesota and North Dakota where we went into small organizations and helped them implement this. And there was one small piece of this requirement in order to get the funding that they had to do a HIPAA risk analysis, but nobody was doing it. And I had practices that had to give back millions of dollars because they didn't do it and they said they did.
Oh, wow.
So that kind of I was the person who really ran that piece on the grant project, but once that subsided, I knew there was a huge industry that just needed help, that doesn't need a full-time HIPAA person there, just needs someone to help them set up what they need to do, keep them kind of in order throughout the year, and give them the assurance that they're good with what they have. I mean, you can't ever be 100% that you're not going to have something happen, but sometimes it's just responding to it. So that's where my passion is. From an aspect of patient rights, patients have rights under HIPAA. They should have rights to their medical records. I've personally been involved with trying to get my mom's medical records to get her transferred to a different state, and it was so painful. And that's my world, so it shouldn't be painful. So being able to support both the provider as well as the patients getting access is really where my passion comes in. I like to tackle the problems. I always say that I think operationalizing HIPAA is the hardest thing, but making it work for your organization is the biggest thing. So that's where my passion comes in.
Wow, that's fantastic. I mean, I can feel your passion when you talk about it.
Thank you.
So then, as far as Planet HIPAA goes, if
Yes.
how does somebody get in touch with you? How do they retain you for your services? How
Right.
does all that work?
Right, super simple. So we have a website, planethipaa.com, that they can go on and visit. They can email us right from the website. We also have a 30-day money-back guarantee. So if they sign up for the product and they're like, this isn't for us, it's not really what I'm looking for, 30 days, no questions asked, and you can, at any point in time, cancel your contract with us. So.
Wow. Well, it sounds like HIPAA is for everyone.
For everybody,
We
yes.
all have to do it, so
Whether
we might as well.
or not, right?
Yeah, so we may as well make it as easy as possible.
Right.
So, well, Dr. Danika, I want to thank you very much for being here today and for sharing all of your knowledge and your information with us. So thank you very much.
My pleasure.
Yeah.
Thank you.